Right. Boom. Hello, this is Matt Perlstein from EQ for Peace. We are doing the Positive Mental Health Symposium, and we are trying to figure out how to handle our mental health better. We can do better. We can learn how to manage things inside of us and include the negative stuff, and we can come up and do the positive and become more positive actually because we had our pain, in spite of our pain, however you want to put it, our trauma or issues, our upbringing, whatever happened to us. We can learn from that stuff and end up being better because of it. We can be better because of it. So I'm calling that positive mental health. And we're exploring today how to make that happen and how to function better, even though stuff's happening to us. And reality is life right now is tough, and it's looks like it's going to get tougher. We got to be able to handle the negatives, and we got to switch them around to positives as best we can. So this is Dr. Bill Overton. We are going to be talking about trauma today. He's a very, very, very experienced educator, and both in social emotional learning, which is EQ, what we usually talk about, and also in mental health as far as we're talking about trauma today. So welcome, Bill.
Hello, glad to see you guys again. Thanks for having me here. Yeah, I got into this topic, as a principal and a longtime mentor teacher at my school, and teachers are always baffled by these kids that had severe issues, were defiant, or whatever the issue was. And so I became interested in, okay, so what makes these guys tick? Because unless you believe that there are actually rotten kids that have one intention and one purpose to be on face of the planet is to disrupt or hurt your feelings or something like that, then you've got to believe that this came from somewhere and it's not something that they were necessarily born with. So I got into the idea of trauma a little bit, and started hearing some things about it and reading, and took some classes on it. And I figured, I think that it's probably something that more of us need to know more about, because it does have some stigma sometimes. It does have some different connotations that are not all that pleasant. And also it oftentimes is thought of as basically that's it. It's permanent and you are stuck with this trauma, these feelings, and that's not the case. And so I'd like to share a little bit of what I've found in the last few years, and that's all right with you. And I'll try and be quick. It's only 105 slides, so I hope that's right.
Oh, you got a whole hour.
I'm only kidding. Yeah. No, it's only a few. Yeah. When we think of trauma, usually we think of something that's major that happened, and it's large scale and dramatic and life changing, and oftentimes it is. But the thing about it is that most people have experienced trauma at least once in their lives, sometimes even more. One of the things that makes it difficult is that when we're exhibiting some of the trauma's symptoms or results of trauma, they're invisible sometimes. So we don't know if this person next to us basically is dealing with all kinds of internal pain or disruption, whatever, because of something he or she has gone through. And so basically it's a normal reaction to an abnormal event is the way it's defined. And it's both a physical and an emotional response to a distressing event. Basically it's a common normal reaction in some ways, but it can also last long-term and can cause sometimes unpredictable symptoms. It's our body's reaction though that sends us into fight, flight, freeze, or faint, that's similar to stress, that basically makes it feel bigger than it maybe should be sometimes. A new study recently came out saying that trauma is really in the eye of the beholder. And I kind of suspected this, that the trauma is relative to the individual. It is relative in type and in severity and duration and all these other things. But even the medical professional and psychological professionals are now just assuming that all patients are coming in with some form of trauma that might be affecting their well-being. So they just assume that now versus try and diagnose that or in some other way or figure it out in some other ways. basically they figure that about 75% of the students that we deal with have experienced some degree of trauma, and some of it is chronic by nature. Um, as it turns out, the event itself that was the cause of the trauma is not necessarily the trigger afterwards. It really is what our bodies uniquely, how they respond to them, that cause the health problems. This is directly from all the work that Dr. Bessel van der Kolk has done over the years. He's the author of this book that's on the screen. And that basically his contention is, and is lots of evidence, is that our bodies hold it. And basically that's the way to, the idea of linking the mind and the body together, or reconnecting the mind and the body together, is the way that some common therapies based on his work are operating now. And that some of people even go specific as saying that our trauma is held in the psoas muscle group, which is the only muscles that hold our torso to our legs and lower body. And so basically that's where they say it is. And so there's some special specific treatments that work just on that. As you might know, trauma is linked to lots of depression, irritability, anxiety, suicidality, post-traumatic stress disorder, and it's all. And it can also affect your physical health years after the event occurred. Seeking professional help is a nice way to begin to deal with some of the effects, but it's not the only way. They say that there's a thing called ACEs, and that stands for Adverse Childhood Experiences. And those kind of experiences go across all sectors of society. And they say in the United States, at least with adults, that 62% of us have had experienced at least one ACE. And within the United States, 25% of us have experienced 3 or more. I think that 25% is pretty conservative. I think there's a lot more than that. There's been lots of studies on the effects of ACEs, and with children especially, you can see some of the stats right there. You're 10 times as likely to have injected street drugs. You're 4 times more likely to have heart disease of some kinds. And so the adverse effects of trauma and its symptoms can be pretty bad, pretty significant, and life-changing kinds of experiences. There's basically 4 kinds of trauma based on cause. There is the kind of trauma where you basically come out of an immediate aftermath of an event. The reaction is of short duration, and but it's still very intense, and the symptoms can be plentiful there too. There's chronic trauma, which people live with basically for extended periods of time. People living in poverty experience trauma. People that are victims of persistent bullying, or neglect, or physical abuse, or domestic violence, and all the many other causes are more like chronic. And those are also extraordinarily have effects of huge life-changing kinds of experiences. Just a note is that they say that actually negligence is in kids is one of the largest population or cause of childhood trauma, then neglect by parents. Complex trauma is basically comes from multiple traumatic events. And then one that's very interesting to me is secondary or vicarious trauma, which they found that just seeing somebody else traumatized or hearing of somebody else being traumatized can cause its own trauma. It's called vicarious or secondary, indirectly. So basically, you can kind of imagine that, trauma is all around us. You watch TV and you're on TV or whatever, and that can be traumatizing in some way. And so I think that's interesting. There's also different kinds of trauma based on impact to daily life. Acute stress disorder, which is ASD, is where there are extreme effects and they're present interfere, but they interfere with daily life, and social functioning, but only for about a month or so. And then there's PTSD, post-traumatic stress disorder, which has severe effects also, and affect life in significant ways, but last for over a month. When I mentioned some of the exercises or treatments for specifically for addressing the psoas muscles, as well as the two different kinds of stress disorders are called TREs. And they've been found to have some success, especially with soldiers, in reducing the effects of severe trauma. Then we have the effects on the brain. They found that trauma actually permanently changes the brain. That sounds like kind of a terrible sentence to have because you've experienced some trauma, but it's not the case. But it does change the brain. For kids, it shuts down the orbital frontal cortex. And that part of the brain is basically responsible for inhibiting our inappropriate behaviors. And if you think of a young student, if he or she's been traumatized, what do they need to do in school? Is inhibit those inappropriate behaviors. But if they've been traumatized, they might have had part of their brain that helps with that shut down. Another part of the brain that's been affected is Broca's and Wernicke's regions, which are regions that are vital in learning to read and having reading skills. And the other part of the brain that can shut down is dorsolateral prefrontal cortex, which allows the brain to learn from the past. So if you think about it, is that if you have somebody in your classroom or a student or a family member or a spouse or a partner, and he or she basically can't inhibit inappropriate behaviors, has difficulties with reading kinds of skills, language skills, and also doesn't seem to learn from the past, you might be looking at symptoms of that are caused by some form of trauma. Trauma also really reduces the amount of feeling good hormones. The love hormone is sometimes called oxytocin. And basically it's the relationship between a mother and a child, which again, if you are one or the other has been traumatized, that might be difficult to release the oxytocin between mother and child, also between romantic partners. Trauma in extreme cases can cause flashbacks, nightmares, unpredictable emotional outbursts, headaches, and also physical symptoms of one kind or another. They've also found that some groups in our population are more susceptible to trauma than others. Basically, people of color, Black, Hispanic, Asian, or multiracial have a higher percentage of trauma linked with them. Also, if you have less than high school education, poverty is a huge cause, I guess, or attribute or common characteristic of people that have had trauma. People are unemployed, and people who identify themselves as LGBTQ. And so these are kind of groups that, again, you might pay attention to if you're working with any of these people or young people or whoever. And kind of you might look and keep your eyes open for signs of trauma. There are lots of effects, possible effects of trauma on people. The previous author, on the symposium talked about attachment issues, issues of boundaries, reduced empathy, inability to trust. It goes on and on. Regulating emotions, reacting negatively to stress, often have increased medical issues, self-regulation issues, lack of behavior control, cognition, low self-concept or esteem, depression, and also difficulty in reading emotions in others. So these are all, I look at them as effects, but I also look at them in working with people as symptoms or pictures that might, if I see it coming out with somebody I'm talking to or with kids, I might go, oh, I wonder if this comes out, or is the cause of some kind of trauma that has happened with this person. And so it's not basically, kind of a death sentence at all. It's more of just that these are things that might cause you to be curious and look further. Some of the causes of trauma, I've talked about a few of them, but there are lots of them, as you might imagine. That's kind of my point for doing this little talk, is to help more people understand that we're kind of surrounded by trauma of one kind or another, if everybody's had some kind, and also if it's relative, if it's been, if there's some kind of, you know, again, these characteristics that in people, young, despite despite of what age they are, it might at least give an explanation of where it might come from. Even with kids, about the first one, they understand when their family has financial instability. So even that can be a cause of trauma. Bullying, for sure. Change in family or presence, or significant adult presence. Parent or child hospitalization. There is one story I'm aware of where a mother went into hospital for some reason for a few weeks, and it so traumatized her son that I guess wasn't allowed to see her very often, and basically it changed their relationship for quite a while afterwards, because he basically just tuned her out and bonded with, I think, the babysitter or something like that. So these causes of trauma can be something that we consider more normal in life, but also may have this kind of effect. Not connecting with school or teachers or classmates, changing or moving, a fear of shock from other sources, intensive labeling by ourselves or about ourselves or from others, whether you're in special ed or you're not trying or you should know better or whatever it comes. Those labels can be traumatizing too. Remember, trauma doesn't have to be this huge event. It can be chronic by nature, and it can be, to you and I, might be, that's not traumatizing, but to somebody, because of their unique physical makeup, it can be more traumatizing. So it's all very, very relative of who is actually traumatized or not. I mentioned before, watching or hearing or knowing others being traumatized, different kinds of abuse. Abandonment was talked about by the previous speaker. Fearful situations, physically painful situations like violence, and then definitely something that I saw a lot of was social embarrassment, shaming, and humiliation. Boys have a particular interesting kind of characteristic related to this, is that it's really big for many boys, according to Dr. Pollack from Harvard, that they have the fear of being humiliated. So it's not being humiliated only, but for boys, it's also the fear that that might happen. But the good news is that these effects can be reversed or reduced or made better so we can have more normal and better lives. These are the first steps, that you can do yourself, like adjusting your lifestyle and eating right, exercise, sleep, things like that, water, and also consciously finding things like play and laugh, things that cause laughter, to as a part of your day, those things that release oxytocin, and then also release your stress level. These are all good ideas for all of us, right? But mindfulness and meditation help a lot too. And also realizing that you are not crazy, or imagining it, feeling run down for an extended period of time, anxious, constantly sick. I mean, all these things and these other effects that I mentioned before could all point to you have been being traumatized in some way at some point in time, or are continuing to be. And so some other things you can do, like I mentioned, mindfulness and social emotional learning, Tai Chi, massage. Be careful about your self-talk. If you're starting something new, don't say, I can't do it. This comes from Carol Dweck's work at Stanford. You can say, I don't do this very well right now, or I don't know how to do this yet. That has actually huge benefits, especially for students that use that language versus I can't. Sharing your stories or traumatic experience you had with others, and seek professional help. Exercise, modeling forgiveness for yourself. I don't think that we are very good, at least in this country. I don't know about the world, but at actually not only practicing forgiveness, but modeling it for others. I don't think my kids learned how to forgive necessarily. And I think in their young adulthood, they kind of still are reeling from some of those effects. Be consistent and loving for yourself. I mentioned before already, include play, relaxation, and fun as part of your daily routine. And what might be an interesting way is to discover what your own love language is. I'll explain that more in a minute. And be careful of, again, your self-talk, of inaccurate perceptions, generalizations, and labeling for yourself and others. And don't expect yourself to be perfect. Find personal time to spend with each child in your family and for yourself. And they've also found with some research that volunteering to help others, kind of getting outside of yourself, can be really helpful too. Then this guy, Gary Chapman, came up with the love languages, if you haven't heard of that before. I think it's fascinating. And what his contention is that we all respond better to and see it as love in one of these ways, or predominantly one of these ways. He also has books for adolescents, love languages of kids, and all kinds of different permutations of this language. But basically, think for yourself, which one, if you had a choice of one of these love languages, would you pick? Would you pick to have words of affirmation, quality time with yourself or with somebody special, physical touch, acts of service, and receiving gifts? And I think that when you kind of come up with one, or you can just make it as kind of a quest to find out what yours is, you can try giving yourself a gift and see, well, that didn't feel very good, or that didn't do anything, and see what benefits you have. Also is a good experiment to do with other people that are around you. I challenged my staff at one point in time when I was a principal to see if they could figure out what each of their students' love languages were. And so it's kind of an interesting kind of project to take on. And then that pretty much wraps up what I wanted to say with this, and it's just an introduction. But everyone has or will experience a form of trauma in their lifetimes, probably more than one. It is relative in size, cause, and intensity, and is often very difficult to identify. Just because a person was in the service doesn't mean they're traumatized, but it also means that they could be. I mean, just like everybody else in the world. The effects of trauma can be reduced, reversed, or remedied over time, especially if you do take care of, do several of these things that were talked about. And then most of all, remember that you don't always know if who you're dealing with has trauma or not. So handle everyone gently, handle everyone with care, even strangers on the street. Realize that, whoever they are, whatever they look like, whatever they're doing, they might have been traumatized and are reacting to some kind of flashback or some kind of trauma effects. And you saw that there are many of them. Makes for a more peaceful world too. That's pretty much it.
Nice. Excellent. All right. Yeah, that was really good. That was a very good recap of how it gets started and how it stays in us and how to do something about it. I'm super happy to hear that we can do something about it. We can there's hope, right?
Well, I think that some of us sometimes think, okay, that was a traumatic experience and now I'm damaged for life. Are you changed for life? Parts of your brain, the scientists would say yes, but does that mean you are a different person? Does it mean you don't have skills? It doesn't, it doesn't mean anything. And basically you can get rid of any kind of anxiety or anything that, you hold inside in a variety of ways. And it's just really about taking action.
We actually were working with we've worked with a lot of military veterans, and it's true. A lot of them I found came back from Vietnam or from more recently the Middle East and such, and saying, okay, I've got this PTSD now. That's it. ... Now I got to live with it. It just is. And I was like, no, that's a terrible mindset to just have to deal with it for the rest of my life. That does not necessarily so.
Right. That's a danger of labels, we see it in education all the time. And basically there is this thing that you probably know about called the DSM, where psychologists and therapists of all kinds have to have a diagnosis from the DSM for the insurance companies pay for any therapy. And the thing about it is that first, the way that was invented was kind of weird and inaccurate to begin with, but it's a label.
Hmm.
And the label is intended to help people diagnose and cure. But some
Right.
people see it as, like I said, a death sentence or a major wound, something you're going to carry around with you like a tattoo for the rest of your life. And that's not the case at all. In fact, I'm so anti-labels that I would love to see, anything with an acronym or something like that just, done away with, because they are damaging to people at a very early age. And so anyway, it's unfortunate. And the more we can move away from that, I think the better we'd all be.
Well, so I agree. The labeling can be very tough. It's supposed to be helpful, but it can be tough, and get us stuck in a rut. The other cool part is that as I was doing the research on it, there's a concept also of PTSD, which be D being disorder, or PTSG, which is post-traumatic stress growth, which means that even though this happened to you, you can actually end up better off because of it. What do you think about that?
I think it's possible. I've never heard of that before, so I'm going to look it up. But I think that's possible because changing the brain is changing the brain, right? And like, okay, now I can play piano. I don't think it's that dramatic, but yeah, but I think that our brain. The great thing about the brain that we know now for sure is the concept of plasticity. So basically, you can retrain your brain, and the only thing they say that it takes is willpower. I've added time to that and willpower, but I know of situations where I'll tell you about one where a soldier came back from, I don't remember which conflict it came from, and he had lost the use of his left hand, and he wanted the use of his left hand. And so what they did in a therapeutic situation is have this stack of little colored cones, plastic cones, and for 5 hours a day, somebody would grab his hand, grab a cone, put it over here, take it down, and he would do that because the brain is attracted to repetition. And so you do that enough, and he was able to rewire his brain and get his use of his hand back. It takes time, it takes willpower, but that's a message I think we should be giving to kids that are having difficulties, that this is not permanent, and all this stuff can be changed, with effort and willpower. And so as people that work with people in such situations or with kids, I think it really is our responsibility to be motivators, is to help them to, maintain their willingness, maintain their positive attitudes, because that's going to make the difference in recovery. There's one other story about trauma, then I will leave, but is that with people that had strokes and lost basically, one half of their brain, they, of their use of their body, they tied down the hand on the other side. And so you couldn't use the good hand. Well, what does the brain want to do? It wants to survive. And so it needs this other hand, so rewired. And basically, it's one way that they sometimes address stroke victims. And I will tell you one more. There's this group of kids that have, because of severe epileptic fits and so on, they have had half of their brains removed. Basically, they take them out. It's called a hemispherectomy. Look it up in YouTube and you see some very touching stories. Wow. One of them, I know this story that I've shown in the video many times. Well, they take out the hemisphere, and basically the head fills out, the cavity fills in with fluids, but not brain matter. But what happens, again, plasticity, is that this person who had it done as a young child, basically by 10 had regained full mobility, full cognitive skills, could read just like she could before. Now she has, last time I saw her, she is married, has kids, has graduated from college. And the only thing remnant existing is that she sometimes holds her left hand kind of up like this. And then she's done, physical therapy to try and, get rid of that, but big deal, and she doesn't have these major, kinds of, epileptic fits all the time. I mean, the original video of her going through this was very touching because, you know, as a parent, you just cringe that, you know, this is what's happening to a family and to kids that, you know, that you know, or whatever. But she was able to overcome it, you know, and just by willpower and that whole thing, concept of plasticity. These are the messages I feel like we should be giving adults and kids alike. You can change anything.
Definitely.
Right.
That's pretty impressive about all three of those stories. But that also, you were saying about the stroke victim, they tied part of it down, and so they brain started using that side again.
No, they started using the other side.
Yeah.
So they tied the good side down, and the brain goes, I got to move. To survive, I got to move. And so what does it do? It starts rewiring. And so, I mean, it takes a while. And again, they're also doing some physical therapy with that, but they're able to regain some of the emotions of that, the damaged side of the body. Yeah.
Wow.
Yeah. So anything's possible if we don't label ourselves, cut ourselves short, you know, feel like we start using those words, I can't, instead of right now, I'm not very good at this, or I can't do that yet. You know, those are really key words. And read Carol Dweck's mindfulness. What is it called? I'm drawing a blank. It's a great book. Anyway, but Carol Dweck from Stanford and Harvard is the person to read about that. She's done some great studies. She actually did some of her studies in my classroom, which was kind of cool.
Oh, really?
Yeah.
Really?
Yeah.
I'll look it up because somebody, let's see, it was
Mindset,
the new psychology of success.
That's it. Mindset. Yeah.
Because our first speaker talked about that same book.
Yeah.
So
it's a great book and great words to live by, especially if you're dealing with people ever that where an attitude kind of changes their ability or makes things go more slowly for them. Sure makes a difference, you know, in the classroom, and I think with adults too. Don't allow anybody to say I can't. Just you can say right now you can't do that, or right now it's really hard for you, or I can't do that yet. And so those words alone are huge.
Nice.
Anyway,
nice.
Thanks for inviting me. Thanks for letting me speak.
Yeah, absolutely. That was great. That was excellent. I didn't know a lot of that stuff, even though I've been working with trauma for a long time.
Oh, yeah.
And I didn't know that it's about that stuff, and that the ACEs are one of the things that get me. Those ACE studies are amazing, that they have connecting a direct link between emotional problems as a kid and bad physical problems as an adult. Wow.
Anybody that says that our emotions really don't matter is really wrong. I mean, they matter the most, more than anything, and it's now that good that you're kind of taking them out of the closet, so to speak,
Exactly. I'd say in almost all my workshops, your emotions matter more than you ever imagined.
Yeah.
We were taught, and our culture says, ignore them, don't pay any attention to them, they don't matter, we don't know it, we don't want to talk about them. But wow. Right.
From the beginning, we're kind of bombarded with reasons why we shouldn't think about our emotions too much, and because we're too busy trying to be a good reader or meet other people's expectations, whatever. Anyway, I've gone well beyond my time, so I'm going to let you go.
It's okay. Actually, the next speaker was canceled, right? So you're fine since it's your wife. And also our next speaker, it turns out, is also probably a darn good example of this, because I've known her since she was little, and she's gone through some serious trauma and has come out the other side and changed things around. It's pretty wild. It's pretty amazing to see that post-traumatic stress growth thing happening, and watch people like her that have taken the trauma that's happened and actually made her better, made her more loving, more empathetic, more compassionate, all that kind of stuff, and it can actually make you better.
Oh, that's great. Well, congratulations, Megan. That's great story. I hope you're writing that down somewhere so we can all benefit from it. Good for you. All right. Thanks, you guys. Bye. See you soon. Bye-bye.
All right, Bill. Thanks again, buddy. Bye-bye.